Hello and welcome again to the Discover Reading podcast. After a short break, on this episode, we're delighted to be joined by Dr. Amelia Hollywood, an expert in obesity, behaviour, psychology, and the mystery of human mentality and action in general. We are back in business and enjoy the episode. All right. Hello, everyone, and welcome to the Discover Reading podcast. Today, Phil and I are delighted to be joined by Dr. Amelia Hollywood. Amelia, welcome to the Discover Reading podcast. And our first question is quite a nice and simple one. Who are you, Amelia, and what do you do?
Grand, thank you for having me. I'm a lecturer in health services research based in the School of Pharmacy at the University of Reading. My background is I'm a qualified health psychologist, so that means that I did my PhD in health psychology. So I was looking at a weight loss medication and patients' experiences of taking that. And then alongside that, I did my practitioner training, and I got to work with other patient populations such as people living with cancer, but then also I got to work with some elite athletes as well. So that was my PhD. That's how I became a health psychologist as well. And then I went on and I worked full time in research for a period of time where I was working with people who were undergoing bariatric surgery. So that's weight loss surgery. So I worked on 2 trials on that elsewhere. And then I came to the University of Reading and took up this academic post where I get to do both teaching and research.
Fantastic. Yeah, that sounds like a really broad range of experience that you've got. But one area that me and Chris thought we'd focus on for the podcast was your experience of obesity in general, and also potentially how to change individuals' behaviour around eating and living habits. Could you tell us a bit more about that area of your research?
Yeah, so with the weight loss medication that I was looking at with my PhD, that was a vehicle to help people to change their behaviour. So the weight loss drug is called Orlistat. So it's available on prescription or over the counter. And essentially it stops you absorbing the fat from the food that you consume. So if you take that drug and have a high fat meal, then there are consequences. You don't absorb that fat, so it comes out in, you have diarrhea, oily stools and things like that. So it's quite aversive. It's supposed to put people off wanting to have that fatty food. So we're trying to drive that behaviour change through a medical intervention, but it is purely around changing behaviour, and that's just a vehicle to try and do that. And I guess that's the same in bariatric surgery as well. People are having physical surgery which changes their digestive system. So for example, if they're having a gastric bypass, they actually bypass the stomach and the first third of the intestine, so they're not digesting and absorbing as much of those nutrients, so it goes through. But people still need to change their behaviour as well. So people can get around that procedure and graze throughout the day, and their calorie intake will still be quite high. And also if they're not active, because weight gain is essentially a simple equation. It's just energy in, energy out. So if you consume more calories than you burn, then you're going to put on weight. But obviously it's a lot more complicated than that. Otherwise we wouldn't be in the situation we are. So that's where health psychology comes in, trying to understand why people behave the way they do to try and support them to change.
Definitely. So as you say, it's on paper it looks like such a straightforward calculation, but actually it's the behavioural side that's really fascinating. So me and Chris also were wondering about government initiatives such as sugar taxes and things like that. Do you think that those are effective, or should we focus on other methods?
When it comes to behaviour change, it's very complicated. In my obesity lectures that I give to my students, I talk about the etiology of obesity, so the causes of obesity, and they are very complex. It's the society we live in, it's the people that we live around, the social norms, but also our individual behaviour. And I think that government initiatives can help drive behaviour change. So, for example, with smoking, by making it, by putting the ban in public places, people then had to go outside. And, in the UK, day, especially in winter, it's not great having to go out the front of the pub in the wind and the rain to have your cigarette while everyone else maybe is still inside in the nice warm by the fire having a drink, and you might be missing out on some gossip. So that, again, trying to drive that behaviour change. And I think there's a place for it, but then we have to be mindful of not taxing people based on their income. So it would hit the poorest hardest, because if things went up by even a fraction, they may then struggle to afford that, or they may still choose to have that sugary food or drink, and then they'd have to take cuts elsewhere. So I guess it's a bit of a balance between trying to promote behaviour change, because ideally people would reduce the amount of sugar that they consume. Ideally people don't smoke, you don't drink as much alcohol, so tax does have a part to play, but then we also have to balance that as well.
Yeah, and do you think, Amelia, that we focus enough on early education? So if you want school age, primary school age, up till secondary education. The reason I asked that is when I was a teacher only for a couple of years, but one thing I did notice is that I can't say the lunch which we always provided was that healthy. Obviously, there was pizza available every day. There was chips available every day. And sometimes this did fluctuate from school to school. But do you think we educate them enough in terms of the importance of, first of all, eating a healthy diet, and then secondly, also encouraging regular exercise from an early age?
Yeah, so I think education, especially for the next generation, is really important. Not a lot of my research, I don't do much research on children. I would know more about the parents. And I guess also you've got to balance the amount of education you give to children in school, but then they go home to that environment, and it depends what that environment is like as well, because that will very often drive people's future behaviour. But definitely healthy eating and exercise is really important. And especially in schools, if they eat healthy, then they have better attention in their classes. So it makes life easier for teachers like yourself. So there's that benefit there. And also, exercise is really good as a stress relief. So as much as adults sometimes go for a walk or do a bit of yoga to help with stress, children can benefit from that as well. And so children might be able to have better attention in class, but also when they go home to their families, the family probably like, oh, actually, they're much more calmer. My cousin has got a dog that he makes sure that he walks regularly and takes his children with him, so that they're just tired out by the end of the day. So their behaviour is better just because they're too tired to be naughty.
Do you think there's an element with forming new routines of it needing to go on for a longer period of time? Because I often think about new diets and like New Year's resolutions and things, and you get to a point where you're like, I've done that for a bit, but actually, eating cake, I really miss doing that. Is that a big part of changing behaviour, of how do you make it stick in sort of longer term?
Yeah, so I guess long-term and sustained behaviour change is the holy grail. That's whatever behaviour change intervention we're trying to do, that's what we're aiming towards. And sometimes past behaviour is predictive of future behaviour. So if someone has been successful in the past, then their next attempt, they can reflect on that success and drive it forward. But then equally, I guess on the flip side, if not so successful, they might focus more on that. And some people do have very arbitrary lines in the sand where they can't start a diet until Monday. The beginning of the week is when they have to. They couldn't start it at their next meal or midweek. It has to be on a Monday. Or New Year's resolutions where people start at the beginning of the month and have given up by the end of the month. I think behaviour is very complicated. Why we behave the way we do is very multifactorial. Why we do things. Sometimes it's habitual. So some people have a biscuit with their cup of tea, and that's just what they do every afternoon. And so it feels weird for them not to have that, because they've almost paired those two things together. So maybe they just need to stop having that cup of tea, which then would drive them having that biscuit, or retrain that habit into just having a cup of tea. That's just what they do. Very often behaviours are trying to deal with some kind of emotion as well. Sometimes the behaviours that tend to be harmful to our health tend to have some kind of emotional element to them. Very often it could be just boredom. So people sometimes eat out of simple boredom, or it could be that they're stressed and that's how they eat. But then equally it could be more of a social thing. So they're out with friends and we go out for dinner, and if you didn't have the starter and everyone else did, you feel a bit odd. Depending where you go, there may not be that many healthy options, but the reasons why we behave why we do is very complicated, which is why it's kept me in the job I am, because there's still lots more research to be done.
Yeah, it seems really complicated for sure. And I guess you've got a whole whirlwind of individuals as well there who might be acting, eating, and consuming differently. And it seems like some people, for example, can do less exercise but still be in better shape than some people who appear to do more. So is that something which is quite complex? Is it true that some individuals might need to do more exercise and eat better than others, or is that not true at all?
I think there probably is a predisposition. So people are more likely to put on weight easier than others, but it's not necessarily inevitable. So I think sometimes people rely on that as maybe an excuse not to change their behaviour. But I think everyone can benefit from eating healthier and being more active. It's just some people, it looks like it's slightly easier than others, but there have been experiments that have done where they have followed people who seem to be able to eat what they want and still stay skinny versus people who eat a small amount and seem to put lots of weight on. And actually, as it turns out, the people who seem to eat lots actually didn't, and they were more active. So over the day, their calorie consumption overall, say over a usual week, was actually lower and their activity was higher than someone who seemed to not eat very much. Sometimes people say, I don't really eat, I don't understand why I've put on weight. But then when you break it down, it might be that they're just snacking throughout the day. So they haven't necessarily sat down and had a proper meal. They haven't had their 3 meals a day, but they have been grazing throughout the day. And all those calories mount up. And also sometimes, when you have a busy life, people forget to eat. And so it's not that they're consciously not eating. It's just that they're rushing around trying to get everything done. And so they then I eat loads. But that's just because at one meal, they sit down and have a big meal because that's the time that they have. So it's a bit complicated.
Definitely. That made me think about I keep getting these adverts for this app that seems to be focusing more, a dieting app that seems to be focusing more on behavior, and also kind of what you were saying of being more conscious of what you're doing. Of, if you graze during the day, you might not realize that you've eaten that, but this app seems to be encouraging a change in behavior and just being aware of what you're actually eating, which I don't think I've seen that angle before. I've seen lots of diet adverts and things in the past, and that struck me as quite interesting that it was going for perhaps a more of a psychological approach. Do you think that's something that is changing? Psychological approaches are becoming more to the fore with dieting?
Yeah, so within the NHS, there's always been a multidisciplinary approach already. So psychology has been quite embedded within it. And when I've been working in clinics, we've got people to make a food diary like you would. And just by monitoring the food that they eat, very often it makes people more conscious of what they've actually eaten. But then also, so it's like we put them in columns. So it's when they've eaten, what they've eaten, and why they've eaten it. So sometimes people are eating just because it's what they normally eat at 11, they have a schedule of eating. Sometimes it's because they're hungry, sometimes it's they're stressed. There's very different reasons as to why. And sometimes people misinterpret signals, so they think their body's telling them that they're hungry, but actually it might be that they're thirsty and they've just misinterpreted a signal. So I think thinking about why we do things is really important to help to change. I think people generally know you're supposed to, eat your 5 a day and not eat food that's too high fat or too much food, and you're supposed to be active. But actually putting that into place is really difficult. Trying to fit it into your lifestyle, or some people don't have the skills necessarily to eat healthy because they don't know how to cook. So it's working out the why behind each. It's kind of different for everyone. And I think you need to take a more individualized approach. But then, like we were saying earlier about the government initiatives, I think sometimes they can help on a more population level to try and nudge people in the right direction. But I think in terms of individuals, changing behaviour needs to be personalized to them. And for some people, they have a significant event that drives that change. So for some people, it might be a significant birthday. So they turn 40 and they want to change their life, or people get divorced, or there's very different reasons why sometimes it drives this light bulb moment where people go, I want to change my behavior, and can be really successful at it. But sometimes it can just be a case of people have just had enough of whatever the consequence of their behavior is. So for example, if they're not being very active and eating too much food, they've just had enough of it all and they just decide to change. Likewise with smoking, there are cases where people just throw away all the cigarettes. They're like, I've just had enough now, and they're just in that moment, they've just decided, they had their light bulb moment, I don't want to do it anymore, and then change.
Yeah, It's interesting you say that, actually, because my dad was like that. He smoked a pipe. Actually, I was chatting to Phil about this yesterday. He smoked a pipe until he was about, I think, mid-30s, and then one day he just had enough. He got a cough, and boom, completely and utterly changed. But yeah, one of our questions was, at times it feels like we live in quite a forward-thinking world, but are there lessons which we can take from previous generations in terms of how we can prevent obesity? Were people in the past actually eating better diets and being more active than we are now?
So I think looking at the data, it looks like probably they were. Obviously, we can't say how accurate the data is that's been collected in the past and the methods that were used, just thinking with my critical hat on. But yeah, I think traditionally maybe eating was more of an event. So people sat down as a family to eat in the evening, whereas now maybe people might just grab something to eat quickly or sit in front of the telly and eat their dinner and not necessarily enjoy it as much. There's a lot more convenience food. I guess previously food was more difficult to come by, so you can just grab something on the go. But also, I guess, our lifestyles. So, I mean, definitely since lockdown, my activity level's gone down because my commute involves walking from upstairs to downstairs, whereas before it was walking either to the station and then walking from the station to campus and then walking through. We don't have a small campus, do we? So then walking through campus to get to my office. I guess incidentally had lots of activity in my day, and then I play a lot of sports, so then I'd go off to training in the evening and do another couple of hours in the evening as well, and then gym, yoga, all that kind of stuff fitting in around, but the incidental exercise has kind of disappeared from my day-to-day life, which I think it has for a lot of people. So I think lifestyle does play a part in how active we are. And so previously, maybe traditionally people would have been more active in their jobs, less sedentary, office-based occupations, I guess, previously. So all of that would have driven how they lived then, less processed foods and things like that. All of that will have played a part.
Yeah, and that's interesting what you say about convenience, and it makes me think of the idea of kind of instant gratification. We talk a lot about sort of social media and dopamine levels and people wanting to get the number of likes on their post and things like that. Are people making that connection a bit between the world that we live in now with a lot of instant gratification and the way we eat, or is that not quite right?
Yeah, no, I think that's definitely coming out of the literature that we've been collecting through research, is that people are thinking about the short-term, I guess, gain versus the long-term costs. So the kind of cost-benefit analysis that they do, either consciously or unconsciously, they're thinking of the immediate. And I think that's why, sometimes people get into trouble with their finances, because they see something they want and they get it straight away without saving up to get it and then buying it. And I guess it's the same with eating. I used to tell my patients, what, if you want to have some chocolate, that's fine, just maybe give it a day or two, and if you still want it, have it then, but just see if you actually do genuinely want it or not, rather than having it and then regretting and thinking, oh, actually I didn't really enjoy that. There is something about that cost benefit analysis that people are focusing on. It's difficult, I guess, to think about the long-term effect though on your health. If that one chocolate bar is maybe going to give you a couple of extra pounds, but if you keep having that extra chocolate bar, it will eventually accumulate over the years, and then how will that affect your life? You might get it built, you might not, you might live an extra year of your life at the end. It's difficult to weigh up that, I guess, that abstract concept of that long-term benefit.
Yeah, and then the other question which I was quite curious to ask, Amelia, is there a kind of point where it becomes really hard for somebody to make a change in their life? Let's just say they get to such a level with their obesity that it becomes such an amount of work to get down to a healthy size that quite often people turn off. Is that something which you used to see in your practice?
So when it comes to weight, I think some people can't quite conceptualize like someone who's morbidly obese and how much weight they would have to lose. They would have to, if they just purely went on a diet, they would have to be on that diet for a couple of years to get maybe down to being overweight. And so that's where bariatric surgery is a really useful tool. But behind that, in terms of someone having bariatric surgery, is they have to seek help. So that in itself is a behavior. So someone has to go and speak to their doctor, and identify that problem, and then they can come into the NHS system where we can then look after them and make sure they go through the right tiers of support. So when someone comes in with a weight issue, it may be that they just need to see a dietitian to adjust their eating behaviour, but someone who is morbidly obese and maybe has type 2 diabetes, high blood pressure, they would probably need to go into the surgical route and have bariatric surgery to help them with that weight loss. When someone's having bariatric surgery, they actually go on a diet beforehand to reduce the size of their liver, because by having bariatric surgery, you need to try and get to the stomach to do the operation. And the liver, when someone's obese, is quite engorged in fat, so it becomes quite enlarged. So they go on a liver shrinkage diet before they have surgery, so that the liver can shrink, so that when they do it laparoscopically, so that's where they put like little sticks in and the cameras and all their things go in. So there's just 2 little incisions that go in, and they have their surgery. So by reducing the size of the liver, actually the surgeon can get in there and do the surgery a bit easier. But by going on that diet, very often people do lose quite a lot of weight by going on that diet alone. And sometimes we have had occasions, I mean, it doesn't happen very often, that patients go, actually, I don't want to have the surgery. I want to keep changing my behaviour because I can see the impact it can have on my body, how much power I have. And I think that's it as well. It's like empowering people to take control and to feel that they can do it. Because very often when someone becomes obese, they've done diets before and they've failed, and they feel like they don't have control over it anymore. And so that's where sometimes surgery can help. But sometimes, by speaking to people, you can try and empower them to support them to take control of their own behaviour.
Just thinking about COVID-19, obviously it's kind of unavoidable, and you mentioned earlier about the effects of lockdown on I'd say probably most people in terms of exercise and diet. And during COVID-19, we've all become a bit more aware of the government scientific advice body, SAGE, and how that's kind of made up of. And obviously, part of SAGE is made up of health psychologists.
Yep.
So we're wondering what exactly is their responsibility, and also should we be paying more attention to their advice alongside the traditional epidemiologists?
So health psychologists are definitely part of SAGE, and I've seen that several of my colleagues on the news over the past, where are we now, 18 months, maybe more. And so, I mean, our strength in terms of being a health psychologist is we have a lot of theories that we can use as a framework to help understand people's behaviour. And also we're very good at, reviewing literature and evidence and using evidence to inform decisions. So very often the data that was presented on next slide, please, in the government presentations, that's the data about what has happened. Whereas as health psychologists, we can try and change what happens in the future, because by driving a behaviour change, you can help change things. And so I think as health psychologists, we can apply theories that we're familiar with to different issues that arise. So in my research, I use it for obesity, pain management, and various other aspects of health. But then we can also use it in global pandemics like COVID. And there was a paper out recently which did apply. It's the members of SAGE have written several publications, and one of them applied health psychology theory to this. What have we learned from what has happened, and how can we maybe help improve things going forward? And there's a thing called combi models. So it's where you think about behaviour, which is the B, and then you have the COM, which is capability, opportunity, and motivation. So in terms of trying to get someone to change their behaviour, do they have the capability to do that? Do they have the skills? Do they have the equipment? Do they have the things that they need? Do they have the opportunity to change their behaviour? Are there situations whether that's social, physical opportunity to do it, and then are they motivated to do it as well? So when you think of it that way, even down to just if the behaviour is hand washing, do people have running water and soap to wash their hands? But also, do they know that they're supposed to use soap when they wash their hands, or you're supposed to wash your hands supposed to sing, is it happy birthday or something? But then, when people are out and about, do they have the opportunity to wash their hands or not? And then if not, what else could we do? And are the people motivated? So do people around them do it as well? Is there a social norm? I think I definitely noticed that with the face mask. When they were first saying about it, I was like, I feel really uncomfortable. This is really weird. Like, it just felt really uncomfortable to do it. But then when I saw everyone else doing it, I was like, it's easier to do when everyone else is doing it, because it's just the norm. It's just what you do, and there isn't much thought behind it. It's a behaviour that you end up doing without much thought. So I think when in terms of health psychology, we can apply our theories to different events that happen to help give a framework in terms of understanding it and working out a way forward.
Yeah, I think your point about the adoption of face masks and viewing that from the start to now is absolutely fascinating as well, because you can literally see, at the start it was a bit odd. People were, is this, and then the behaviour became absolutely second nature. I'd literally forget whether I was wearing one or not, I think, in supermarkets, and then now it's got to a point where it's a bit awkward, because you think, well, not only half or less than half the people are wearing them here. I will wear one, and then sometimes you think, oh, hardly anyone's wearing one. Maybe I'm a bit odd if I do. It's fascinating how quickly that can change from one to the other and back again. And as you said, change has been a big part of it. I think a lot of people say that, oh, you should be able to just go back to the office now and go back to the way you were before COVID. But actually, it's a change from how we were. You can't just snap your fingers and be exactly back to pre-COVID. It takes time to adapt. On another podcast, talking to some biomedical scientists, when we said, is there anything that could come from COVID at all? They said, well, hopefully it would mean that people's behaviour did change in the future, that perhaps that's one benefit that would come from the pandemic, is that people will adopt a healthier lifestyle. And I was interested, what are your thoughts? Do you think that will happen, or will it be like the masks thing where people think, oh no, this is not how it is anymore?
Yeah, I think it is a complicated one, because like I was saying before, past behaviour does predict future behaviour. And so how people behaved before the pandemic, they may go back to, whereas for others, they may take it as an opportunity to reinvent themselves and take it as a reset button, to be different going forwards. But I know just from anecdotally, like the two lockdowns that we had, so we had one right at the beginning and then we had one kind of around Christmas time. And I know people acted differently in the two lockdowns as well. So I know the first one, it might have been to do with the time of year, but a lot of people went out running every day. They started eating healthier. They really were trying to be the best version of themselves. But then by the second lockdown, I think they've just kind of given up on that. And they're like, you know what, I'm just going to binge watch all these box sets that I've got lined up, and I'm just going to have comfort food. And again, it might have been time of year, but I think sometimes people can take different opportunities from this, and each day is a new opportunity to make a change. And I think if we empower people to make sure that they know that they're capable of doing something, they have the opportunity and they're motivated, if all those elements are covered, then people then have more of a chance of making healthy decisions and being healthier in their behaviour going forward, which is beneficial for them at the end of the day. As healthcare professionals, we try and support all our patients, but in terms of the benefits, it's for the patients. By them being healthier, it's for them to have a better quality of life. I mean, essentially, we're doing our job, and yes, you get a good job satisfaction from doing that, but ultimately it's for their benefit that we're encouraging this health behaviour.
I fully agree with that, but quite often, we all got used to seeing Boris Johnson up there with Chris Whitty and Valance and hearing all the various statistics and hearing the reasoning behind the latest decision making. But one interesting thing which I did know, and I've heard other people say this, which is, do you think maybe some of the government briefings, there should be more focus in terms of actually trying to encourage that healthier lifestyle and the positive impact that can have not only for COVID, but also for the range of other diseases as well? Or do you think that wouldn't have been the appropriate format to try and give that kind of message to the nation?
So I think probably in the early stages, the government probably weren't talking to health psychologists as much as they were a little bit later on. Essentially, I think to begin with, they were in the kind of fighting the fire type situation. So the NHS was under strain and they had to deal with that. But I think, yeah, definitely we could have reduced the spread of it if people had changed their behaviour a lot earlier. But some of that is driven by the structures that we have in place. So my work, I used to have to go onto campus every day. And so that meant me going on a train with lots of people and then going into a lecture theatre with hundreds of students. And if I didn't do that, I wouldn't be doing my job, which would mean I wouldn't be getting paid, which means I couldn't pay my bills. So some behaviour you don't have much control over. So I think very much the government did have to step in and say what had to change in that sense. But then I think probably some of the mixed messages didn't help as well. So I think some people were a bit confused as to what they should and shouldn't be doing in the early stages. I think that definitely had an impact on people's behaviour because they weren't quite sure what they should be doing. It wasn't a nice, clear, concise message about what should happen. And then we went into, what was it? Face, space, whatever it was. You had to wear a face mask and wash your hands and stay away from people, essentially. And that was a nice, clear message. So then for a while, we had a really clear message. Try and keep away 2 meters away from everyone else. Make sure you wash your hands, wear a face mask when you're in enclosed spaces. It went to a really clear message. But then after that, when things have changed again, it goes back to this really grey area where people don't really know what they're supposed to be doing. And they're looking to the government or to experts to tell them exactly what they should be doing. But it's difficult when it's a grey area in terms of what you actually should be doing. I mean, we should all be keeping space from each other, but then equally you need to interact with other people to have a good quality of life and for mental health. So there is a lot of balance that comes into play there. And I think maybe more behavioural suggestions would have been useful earlier on, but that needed to come alongside a really clear message as well, so that people knew exactly what they should be doing.
Definitely, the clear message was definitely appreciated when it did come, I would say.
Yeah.
But as you say, it's that point of when it's at absolute crisis level, it is easier to be like, right, just do this, and then when things calm down a bit more, it does become more complicated. But it's been really fascinating talking to you, I think, because everyone's fascinated by everyone else's behaviour and then also their own as well. There's that element of, why am I doing this? I know it's not right. So it's been really, really good to talk to an expert about this. So thanks so much for coming on the podcast.
No worries.
That was a cracking episode with Amelia talking us through the importance of health psychology in improving people's diet and lifestyle, putting the need to question why you're doing what you're doing at the heart of tackling obesity. Keep an eye out for more fascinating episodes about the work we do at Reading, and thanks for listening.